I want to thank each and every one of you for being here today to embark on a journey that maybe some of you have already started. Some of you have already perhaps been through a couple of the accreditation domain efforts to collect documentation. Some of you, this is the first time really getting involved in hearing more, and why am I here might be a question on your mind. And so hopefully we will completely and fully address those questions that you have. My name is Ken Johnston, and I am the Chief Compliance Officer for the Department of Public Health. And it's my pleasure to represent the administrative office in the department to really give you hopefully some assurance that we as the executive staff are 100% committed to the future success of this department in every way, shape, and form. And one of the ways that we can help assure that we will be successful today and into the future in meeting the needs of our community and fulfilling our strategic plan and the objectives and goals that we have is to pursue this accreditation opportunity. And I thought I would start by really just kind of giving some history about public health. Some of you are probably MPHs and have a great amount of schooling and training in terms of the history of what public health is in this country. But if you go back 100 years, we have made incredible progress in immunizations and perhaps eradicating many diseases and providing vaccinations that prevent the spread of diseases and introducing policy and regulation that address how the population's health can be improved by involving every one of us. And if you go back to the turn of the century, or actually before that, and we had a great deal of immigration taking place in urban environments that were not conducive to public health. There was improper sanitation, poor air circulation in tenements, or poor water supplies. There was vector problems that were spreading disease, and we addressed all those through legislation and policy and introduction of new technologies and medications. Fast forward 100 years later, and although we have made significant progress in what we do in public health, we haven't really comprehensive or standardized a way to address the quality, how well we do those things. Now, some programs and some legislation, some funding sources will require that quality improvement is a component of a set of objectives or requirements or mandates. But the public health group of disciplines overall didn't really address that until just a few short years ago. And the Centers for Disease Control partnered with some other leaders in the public health field and developed a set of standards and measures that are based primarily upon the 10 essential public health services, which I would hope that most of you have seen. There's a colorful wheel that addresses 10 specific things that public health is responsible for. Well, these standards and measures in the accreditation, in the Public Health Accreditation Board, address each one of those 10 essential services. And in addition, add 2 more. And Domain 11 talks about the administration and management of the Department of Public Health. And Domain 12 addresses how we are involved and work with our governing board, which in the case of the County of San Bernardino is our Board of Supervisors. So now, I want to tell you what accreditation is not. Accreditation, in our pursuit of accreditation, is not a project. This isn't something that we're going to knock out and hang a plaque on a wall and be done with and pat ourselves on the back. It's not something that's being done by committee. And what I mean by that, it's not the Accreditation Leadership Committee's role to ensure that we achieve accreditation. It's not an administrative committee's role to ensure that we achieve accreditation. In fact, it's not even any one of your specific domain teams that are responsible. It's Jose, it's Jerry, it's Glenn, it's Raul, it's Abigail, it's you. Each single one of you have an important stake in ensuring that we achieve accreditation. And why is that? Because what we want to ensure is that we can instill confidence in what we do individually, that we can go to work every day with a strong sense of understanding that I am equipped to do my job and do it well, that we establish a sense of capability and credibility with those that we serve, the patients and the clients that come into our facilities on a daily basis, or that we go out into the field and serve, with those entities and organizations and agencies that we partner with on a daily basis to fulfill our obligations and strategies and regional goals as a county, that they know that if they're working with the Department of Public Health or any one of our representatives, they can rest assured that they're working with very competent, capable, and credible people. But this isn't a project. There isn't an end date, although yes, it will be fantastic on that day that we get the notification that Public Health Accreditation Board has certified that we have been accredited. That just kind of starts the process going again. This is an ongoing process of achievements and accomplishments, and it will be evolving over time. And I just want to let you all know that your administrative staff, your executive staff, as we have explained to Jennifer as your accreditation coordinator, is really in servitude to this process. When we meet on a bi-weekly basis with Jennifer to do what we call lunch and learns, where she educates the executive team on every single domain, we have an opportunity to go measure by measure and documentation requirement by documentation requirement. We have made it clear, Trudy Raimundo, your director, has made it very clear that we are here to support you, the staff. We are here to support Jennifer as the accreditation coordinator, and she and her accreditation leadership committee have been doing a fantastic job. They have been so committed and so organized and so professional every step of the way, and I think that you'll see that today as you embark on this subject matter expert and domain leader training. So we are launching 8 domains today, is that correct? 8 domains, and we want to complete those by the end of this calendar year. And what we're really doing is going out and just getting a better understanding of what do we have in place today that would meet the standards and measures that the Public Health Accreditation Board has established in version 1.5. It's really a gap analysis, if you will. What policies, what emails, what manuals, what meetings have we documented that will meet each one of the documentation requirements? And then once we have established that, then we can go back and start filling the gaps that we know will be in place. And we'll have a couple of years to do that. So again, this is a long-term process. It's something that is an investment of time and funds. We take it very seriously, and I hope you'll do the same. But more importantly, I hope that you will latch onto this whole thing as something that is an opportunity for all of us, that it is something that can be fun. It will teach you a lot about areas of the department that are perhaps outside of your daily scope of work and responsibility. So once again, thank you for being here.